You are listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rulo, always bringing you the most brilliant guests in the world when it comes to healthcare safety. And today's guest is quite special, and the topic is not a commonly discussed healthcare or hospital issue. And I'm talking about the negative health effects being driven by hospitals, a supposed place of healing, and their blind acceptance and use of electromagnetic fields, microwave frequencies emitted by wireless technology. Our guest today is Cindy Sage, the co-editor and principal author of the Bioinitiative reports, both in 2007 and 2012, and a founder of the International Bioinitiative Working Group. For those who may not recall, the Bioinitiative report is the report on the relationship between the electromagnetic fields associated with power lines and wireless devices and health, and is available on our website, speakupandstayalive.com, and I really encourage you to become familiar with the findings. Let me tell you a bit about Cindy. She is the owner of Sage Associates in Santa Barbara, California. Sage Associates is an internationally known environmental sciences consulting firm. The company specializes in translating complex technical and scientific information for the public and decision makers. Cindy's specialty area of practice is the science and public health effects of electromagnetic fields and radio frequency radiation, non-ionizing radiation. And I'm sure we'll talk about that in a minute. She was the co-facilitator of the Collaborative for Health and Environmental EMF group from 2006 to 2011 and is a full member of the Bioelectromagnetic Society. Her full bio is also posted on our website along with the Bioinitiative report. Well, I am so pleased and honored to have this conversation today. So welcome to our show, Cindy.
Pat, it's really my pleasure, and thank you for having me.
You are welcome. Well, Cindy, as soon as you agreed to be on the show, we sent an email blast to our listeners and our followers asking them to send us their most pressing questions regarding EMF safety as it relates to healthcare and hospital stays. So with your permission, I'd like to format our time together by sharing some of those listeners' questions with you.
It's fine with me, and Pat, I want your listeners to know that I actually prepared an outline of talking points and things that I thought we could cover. But this morning when I saw the questions, I realized they were so excellent, I'd much rather answer questions, than make a presentation. But what I'd like for people to know is that in response to these questions, there's really a lot of reference material and good, solid scientific and public health backup, which we want them to have confidence that these answers that they're going to get are really based in a lot of research.
Thank you for that. And if you send me all of those references, with your permission, we'll also post that on our website so folks can follow up as they wish.
We'll figure a way to do that.
We will. All righty. All right. Well, now, first, before we get into the questions, for those who may be finding us for the first time, or for those who aren't so familiar with electromagnetic fields and microwave frequencies, can you give us a quick lesson? What are they and why are they hazardous to our health?
There are several kinds of electromagnetic fields. The EMF term is sort of the broad umbrella term. Within that, we have the power frequency fields, 50 and 60 hertz, that come from all things electric. They're the electric fields, and magnetic fields that come from things that have motors, things that are wired, things that use electricity. And there are lots of those in hospitals that we want to talk about. They take a certain kind of a meter to measure, and they're a standalone piece of our conversation. The other part of our conversation is about radio frequency microwave signals that are basically the product of all these new wireless technologies. People know them, from cell phones and cordless phones, but in a hospital or healthcare setting, they're becoming, we are now seeing the mass deployment of radio frequency wireless gadgets and monitors and sensors of every kind. And both of these exposures are today listed as possible human carcinogens. This is a formal World Health Organization IARC listing. So there's a great collision coming between this sort of premature rollout of wireless technologies, particularly in healthcare settings, and the health effects they cause. So we need to talk about this and whether or not we have informed consent about it and whether people know about it.
Absolutely. Absolutely. That's why I appreciate your being here. And I'm going to start out our conversation with my own observation / question. I just drove to Colorado and back for the birth of my granddaughter, and I have radiation measuring and meters with me, and I brought them to the hospital during my daughter's labor, and the numbers were registering in the extreme danger zone. And so I decided to look around and see what might be causing this. And initially, getting out of the car, I spotted cell towers, or the cellular repeaters, on top of the hospital building. So now basically everyone in the hospital, patients, staff, visitors, were being exposed to extremely high levels of radiation. So my question is this: why are hospitals allowing cell towers, or these cellular repeaters, to be installed on the top of their buildings?
Well, Pat, I've had the same experience in hospitals that I visited, and we've also done consulting in some hospitals for electromagnetic interference. So it's common to see. Now, the rollout of these, and, the hospitals leasing, space to cell carriers really started around in the early 2000s, and by 2006 or 7, they were everywhere. I think this probably in part predates widespread knowledge about the potential for health effects. So that's a part, but it certainly doesn't explain nor justify the continued leasing of these sites, because they're in a direct conflict to healthcare. Being under them probably is less bad than being in a building adjacent to where they're mounted on a roof. So that's one point of view. And I think probably you were measuring, oh my gosh, there are so many sources now, including, on these mothers in labor and delivery, they're wearing wearable, devices that transmit radio frequency to monitor labor in many cases. So trying to parse, apart all of the different sources of wireless might have been difficult in that setting. Nevertheless, what you were seeing defines the problem. We shouldn't be putting patients, nor should we be putting healthcare workers in these exposures. They're excessive.
Right. It was a frightening...
And congratulations on the birth of your first.
Thank you. And this next question kind of speaks also, because I had the same experience as well. It's from a gal, Mandy, in Phoenix. She said, my son and daughter-in-law just had a baby, and the hospital insisted on attaching an RFID tag, that's the radio frequency ID tag, to her little leg. The reason, in case of a kidnapping, is the medical risk worth the minuscule odds of someone snatching the child and running? In other words, are these RFID frequencies safe?
Well, I think that this is just a really bad choice for a very remote possibility for a child. If you look at one hospital, it's really quite good in California, where I was able to look at the RF emissions from these RFID tags. The child wears one, the mother wears one, and there's one on nurses, and then there's a sensor somewhere, on that floor. And the range of these RFID, and these are radio frequency identification tags. RFID stands for that. They have a range of 30 to 50 feet to the RFID reader that's on that floor. Now that tells me that as a system is logging all activities of the child with the RFID tag at 30 to 50 feet distance, that's too strong an emitter to be on a child, certainly in neonates. And really not warranted in this case. I mean, there just isn't enough risk, and people should be paying attention, and there are many other ways of looking toward prevention of that problem. So RFID tags have no place on neonates.
Right. I mean, just because we have the ability to do something doesn't mean that we have to do it.
That's so right. And I think, as a basic concept for everyone listening, you have to think about the layering up of radio frequency.
Yes.
The number of ways in which wireless is being introduced into medical technology, telemetry, surveillance monitoring, and then even at the checkout, all of the patient electronic recordings, all of these things are new, and they are additive. So the actual cumulative exposure is enormous. So we have an enormous disconnect. We have a mass rollout of unnecessary and risky technology and absolutely no informed consent.
Right. Can a parent refuse and say, I don't want this?
I don't know the answer to that, and I think it's probably going to change, even if we knew today, we won't know tomorrow. But I would reject it as a patient, and I would work with my OBGYN if I were going to deliver at a particular facility and say, going in, this is not a technology that we tolerate, and if you want us to sign a release form saying that we take the risk that our baby will be snatched, that's just fine. But I would shop around, and I would make my concern known, because it's based in really good evidence that these exposures are not good they're not good for adults, and they're certainly not good for neonates.
Absolutely. Just tiny little heads and skulls and little bodies. It just stands to reason that it's not sensible. A quick question. Are those RFID tags, say that's on a little child and the mother and the nurses, are they constantly emitting or only when there's an event where it needs to ascertain where that person is?
Sure. I think the presumption has to be that they're constantly transmitting rather than just triggerable.
Okay.
Rather than only on when scanned. But you have to remember that even in that case, every time a baby is moved around or the mother moves around, there are devices throughout that are wireless sensors. So there are many, many more than just on a child, mother, the nurse. They're throughout the facility. Right,
right. And this is going to translate as well to homes and the wireless baby monitors. I just want to throw that out there as well. If they're dangerous in the hospital, they're dangerous at the home as well.
Yeah, they're dangerous. Baby monitors, electronic baby monitors, are so strong an RF signal that they should never be placed in a crib or in the room of a child. They really shouldn't be used. But,
right.
The other issue with that, of course, is that there have been many high-profile examples recently of hackers actually hacking into the wireless systems, within homes that are maintained wirelessly, where a child can be seen. A child can be seen in a crib, and there can be two-way communication. And people who want to rob a home or simply terrorize a child can do so. And parents monitor if it's not being, actively monitored, could miss this.
Mm-hmm.
So we believe that the ability to hack these systems is also a real concern.
I agree.
Yeah.
Wow. Well, since we're still talking about little ones, Jen in California asks, what about prenatal ultrasound? Is that safe?
This is such a good topic to bring up. I am not the expert here, and I called Nancy Evans in San Francisco, who's a science journalist, healthcare advisor, and she has done substantial work on this, which she has shared with me. The answer is yes. This is a real concern, particularly for the boutique-style 3D, 4D, vanity ultrasounds that are being done to create a photograph or a picture of the baby before it's born. These are to be avoided, completely avoided. They're unnecessary. They're vanity only. We have a number of grandchildren now that are new in the last, 3, 4, 5 years, and I noted that our daughters went through a procedure to check for Down syndrome that involved 2 ultrasounds at a very critical development stage in the first trimester.
Yes.
And they were specifically looking at an ultrasound measurement of the thickness of the neck. Now, if you can imagine subjecting a brand new fetus, just in the first few months, to a big ultrasound and then 2 weeks later another ultrasound simply to do a measurement, this, in my mind, is unnecessary when we have blood tests to do the same thing. We have other tests. So there are probably times when ultrasound is really medically necessary, but it's the kind of thing where we should not be doing it willy-nilly. We shouldn't be doing it for vanity. We shouldn't be doing it when other testing is as good or better and doesn't involve bad exposure.
All right. Mike from Ohio sent this. He said, Pat, I've heard that the frequencies given off my wireless devices contribute to fertility and reproductive problems. Please ask your guest about this.
Mike from Ohio is correct. The evidence is just snowballing. I would first say, look at the Chapter 18 in the 2012 Bioinitiative Report, which is a very extensive review, particularly for male fertility, for sperm quality, for sperm motility, sperm viability. It turns out that a man who is wearing a cell phone on his belt, even on standby, is likely to be creating health impacts to sperm that are irreversible and lead to mutations that may in fact be one of the factors we should be looking at for this epidemic rise in autism and ADHD. We know sperm are subject to oxidative stress or oxidative damage, and this is one of the hallmarks of radio frequency and ELF, non-ionizing radiation from wireless devices and other electric things. So we've known that for a long time. But now that men are keeping a phone in the pocket on, even when it's not transmitting a conversation, being subjected to these spikes in radio frequency as the cell is trying to communicate to, stay in touch with the nearest cell tower appears to be enough to damage sperm DNA. And the sperm has no DNA repair capacity, unlike, I think, every other cell of the body. So once damaged, they're damaged. So it's a great concern for men in fertility, and obviously the prevention here is to think about turning your cell phone off, completely off. Don't put it on a belt for long periods. Don't carry it in your pocket. Don't carry it on your body. Take it out and use it when you want to check in. And if you have to have it on, put it 3 or 4 or 5 feet away from you on a desk or the seat of your car. It's a great concern, and I would invite people who might be more research-oriented to look at some of the papers that actually show photographs of sperm samples that have been exposed to cell phone radiation, where their tails are all deformed and they're sticking together. They're wrapping like mats of grass, how the authors have described it. And these little swimmers are supposed to swim quick to the egg individually, and if they're all sticking together in these big nets, they're not going anywhere,
right,
and they're damaged.
Right.
Preventable, absolutely preventable.
Just some common sense solutions as well. And for women, I think there's many studies that also show that it affects the production of eggs, and that can last for generations.
First of all, the ovum or the egg does not, it has DNA repair capacity, so it appears to be a little bit more resilient than sperm. That's one thing I think we know clearly. But the real risk is for women. Now, think of a nurse or a doctor or a woman who's pregnant. The miscarriage rate from being exposed to 16 milligauss intermittently or over 16 milligauss ELF or more on an intermittent basis is a miscarriage risk. It's about a 4-fold or 4.5-fold increased risk. So we think about miscarriage more for women with respect to a wireless device that has a battery that switches on and off, and these batteries can create ELF kicks of certainly more than 16 milligauss, up in the hundreds.
Oh, wow.
Milligauss.
Yeah.
When you get an email or when you're talking and it's on speakerphone. So that is something that women need to take into account. Any woman, not just healthcare workers, but any woman who uses a cell phone and wears it. Now, there's another facet to this, and we have to consider men and women, and then we have to consider the developing fetus, because the mother who uses a cell phone during pregnancy, in some published studies, we're seeing both in animal studies and human studies that in utero exposure for the fetus can lead to altered fetal brain development. And the way that that's exhibited is that by the time that child is in elementary school, they have more problems with learning and behavior. We are seeing the effects of cell phone radiation during pregnancy, altering fetal brain development in mice and in human children, in the fetus, leading to problems later on. So we really don't want women to be using wireless or exposing themselves to wireless during pregnancy or pre-pregnancy. And for men, we want them to be reducing or eliminating their wireless exposures while they're trying to conceive, and perhaps months before that.
Right.
If it's sort of like parents who, they do everything else when they're thinking about having a child to be safe. This is one more thing on the list.
Yep. Excellent advice. I would say the precautionary principle is warranted here.
Many labs, many excellent researchers, and some of them never before having done EMF, RFR work. It's really attracting a lot of attention because, coupled with the problems, growing problems with fertility in humans, and the growing evidence for lower sperm count and lower viability of sperm, these things tend to be reinforcing of a huge problem. And the last paper I saw published was really interesting. It had a nice scientific title, and then in parentheses it said dial 1-800-EXTINCTION.
Ooh.
And talked about not making some mid-course corrections where they're obviously needed for men to avoid wireless.
Well, I'm glad we're getting this word out. All right, well, let's move on. Nick, the male nurse, sent this. According to Samuel Milham, author of a new alarming study, he says there is a link between obesity and exposure to dirty electricity, and that's a form of electromagnetic field pollution. Is this why all the nurses in my hospital are overweight? In other words, is there a link between man-made frequencies and weight gain due to stress on the body?
Here's what we know about it. Sam Milham is certainly an expert on the dirty electricity issue. And by that we mean the low kilohertz frequency fields that come from contact fluorescent bulbs and the on-off radio frequency pollutant that's kicked out every time you walk through an environment that's rich in, computers and printers and all the things, that have variable speed motors. So hospitals are obviously a place very rich in that kind of dirty electricity environment. Dirty electricity has been shown in some studies to affect blood sugar and insulin. And that is the clue that tells you if you're dysregulating blood sugar and insulin function in people, and you're doing it on a chronic basis in a work setting where people come in 4, 5, 6 days a week, and there are many hours, these people are going to have the kinds of exposures that we would link to blood sugar abnormalities. Getting rid of dirty electricity by filtering of electricity or power quality is the answer to that, and it should be on everyone's radar. There is also some evidence from researchers that mothers who are exposed to extremely low frequency fields or magnetic fields during pregnancy tend to have obesity problems in their offspring. So there's a little bit of reinforcing evidence. But again, this is one of those things people are just beginning to look at. It's a maybe.
Okay. All right. Something just to give some thought to.
Right.
Maybe not for the obesity aspect of it, but from so many other health aspects of it as well. All right. Let's move on. A nurse in Boston emailed this one. RFID tags and chips are becoming a way of life in the hospital setting, and you kind of alluded to that earlier. They are used to keep track of equipment, sponges used during surgery. They can locate the immediate whereabouts of doctors during an emergency. It gives easy access to a patient's medical records through his or her RFID tag, can track patients as they move about the hospital, as well as limit the hospital's liability. Does Cindy think the benefits outweigh the health risks?
No, I don't think the benefits outweigh the health risks, because I don't think any of these people, I don't think hospital administrators nor their boards are doing any due diligence on the health risks of wireless. When there's another option in wireless, they should take it.
Right.
They shouldn't continue layering up. And this is not reducing their liability. It may be short-term, but certainly not when people figure out that this is a cause of cancers, neurological diseases, impairment of immune systems, and a very long list of long-term health consequences, and worse, probably worse, the short-term effects on memory, cognition, concentration, focus of the healthcare workers is reducing their ability to do their job.
Yep.
They're endangering patient health and welfare and healing and treatment by being so groggy, on top of all the other stresses that you have in healthcare workers. And we don't have, if you're listening audience, composed of healthcare workers, you already know that this is a very stressful environment, mentally and physiologically. And to keep adding layers of electromagnetic field and radio frequency radiation that is unnecessary is counter, in the most basic way, to the charge to do no harm. Because people can't keep track of patients or assets, sponges, things that go missing. They can't keep track of schedules as well, because their mental function is diminished and impaired by chronic exposure to very low levels of wireless. And I'm talking levels that are 1/10 of a microwatt per centimeter squared, 100th of a microwatt per centimeter squared, maybe even a nanowatt per centimeter squared. And these hospital environments for wireless are reaching much higher levels throughout. They are saturated with wireless radio frequency exposures that we know today are related to the problems of cognition and memory, concentration. So when someone asks a great question like this and says, well, they're keeping track of equipment and sponges and they're saving money and doctors can be found and so on and so on. Well, I'll tell you what. First of all, not so many things would get lost if they could think straight. And secondly, there are other ways of keeping track of things that don't involve this heavy-handed approach that has health risks.
Yeah. It's true. I've been to so many hospital seminars and been speaking at hospitals lately, and every breakout session surrounds about the use of wireless technology. Rounding with iPads is all exciting, and it's so counterproductive to what we're supposed to be doing in a hospital, and that's healing people. And it's not just the patients, as you mentioned, that are at risk. Now your healthcare staff is at extreme risk of even keeping you safe. So
Yeah. I get calls from people who say their family members, the spouse cannot accompany, the husband who's a heart attack victim to the hospital because she's already become electrically sensitive.
yes,
What a cruel thing that family at a time, in life that is such it's a critical time to provide, family and spousal support. And there are some people today who physically cannot, neurologically cannot handle the exposures they would get going into a hospital. It's not in the mind. This is in the body.
yes,
This is a neurological effect. It's an effect on the immune system, cardiovascular system. So people with medical and metal implants are particularly at risk in these environments where they must go either for treatment or to accompany a family member. And, again, when you draw back, Pat, and you think, well, why are we in this situation? This mass rollout or deployment of wireless has been driven largely by companies that see a spin-off kind of gizmo or gadget that sounds good, but for the RF health effects. And they're being funded and they're being commercialized so fast we can hardly keep track of them. And because they can legitimately say, well, we comply with FCC standards, and they, inevitably they do comply, they're legal. They're just harmful. And until we have new biologically based standards that relate to where people begin to get sick or they can't think straight, which is, are thousands of times lower than these current FCC public safety limits, then we have no break on the deployment other than by complaining or rejecting, treatment and treatment environments that are so rich in RF.
and that's kind of a frightening answer. A couple voices here and there is not going to make the difference.
Yeah. I interviewed a healthcare professional, a physician's assistant, this morning, and asked her to describe a typical day to try to say this is now the common experience of the healthcare worker, and what is there at work there, and how is it affecting people, and who's driving it. And at the very end of this conversation, which is really enlightening, she said to me that our patients are demanding wireless. It's not just the hospital administrators. They are, in fact, often responding to people in labor and delivery, for example, that want wireless to keep everybody out in the waiting room knowledgeable and family and so on knowledgeable. Their patient demands to be portable. For example, mothers in labor and delivery, they want to wear wearable, baby monitors because they want to walk around. Well, that's not a good offset. If they knew the risk, they probably wouldn't do it. If they knew that their labors might be extended, their contractions interfered with, all of those things are interference with a normal cycle. So if they knew that, I think they probably wouldn't be opting for it. But, for hospitals that are having robots, for example, for telemedicine, and they do at the hospital, where this woman works, they have no psych and no neurology in that emergency room, but they have telemedicine where they use a robot and a video screen. And, of course, all of that is wireless. The telemetry demands in hospitals are very large. And, all of the printers and that print out your discharge papers, your prescriptions, your medical administration reports, your MARS reports, all the patient documents are printed wirelessly. Mm-hmm. Some of the urgent care centers now are going to iPads, for example, in Berkeley.
Right.
They chart only on iPads, and the people who go in there think it's a really modern, good place to get medicine because they have access to Wi-Fi as well because it was demanded. Yeah. It has nothing to do with patient care, but it's the cosmetic appearance that it's modern. Mm-hmm. So I think we have a lot of patient education to do as well as medical hospital administrator, hospital board education to do in this. I've always said that in my writings on this that we need to educate at all these levels, and that once we have done it, people will start making choices not to have iPads near new moms so they can bond with their infants in NICUs. These are ideas that sound good, but they just aren't.
Right, right. Well, hopefully conversations like this will help bring it out, at least to the patient side, and maybe then they can refuse some of these things. Because I saw the very same thing when my daughter was in the hospital. They came in with the iPad and signed her up for the electronic medical charting. And I also thought about the cross-contamination because I didn't see that iPad touchscreen being cleaned between taking it from room to room.
Absolutely.
So you're also contributing towards whatever bacteria from room to room, especially with little newborns. So lots going on with that is troubling.
Yeah. We haven't talked much about exposures for neonates in NICUs, but certainly people should know that the isolettes, unless they've been really massively redesigned, pose an extremely high electromagnetic field risk for the neonate, and it's with published studies now show that this can affect heart rate variability, the cardiac function of the neonate, which is a horrible thought, and also melatonin, overnight melatonin levels. So if you're trying to establish, for a preemie, if you're trying to establish a sleep cycle, you're completely counteracting it by the motor running, the heater and motor and all of the isolate, the electrical stuff running that will keep it awake for long periods and interfere with its, critical metabolism.
Absolutely. I
But
don't.
beyond that, then you think about a nurse taking in a NICU or an ICU, and their exposures tend to run much higher in NICUs and ICUs because of all the critical care equipment. Because even though they're not the baby lying in the isolate, on the heating pad, or on the hot water bed, or under the billy light, they all have very high fields. The nurses are leaning over them. They're always around them.
Yep.
And so their time-weighted averages are very much higher than standard nursing, certainly outside of the hospital or even in hospital, but not in those units.
I wish a lot of these nurses knew about this, and maybe we need to work to get the word out to them as well, because they would be excellent resources to reach out to the hospital and say, you know what, I can't work under these circumstances. What can we do to lessen this so that I can remain healthy and do my job effectively?
If nurses knew they could do this and wanted to do this, they could wear shielded clothing.
Mm-hmm.
But it doesn't say a lot good about hospitals that nurses and physicians and all healthcare workers would be required to take defensive action against the environments they're working in to heal people.
Right. I mean, a healing environment. Pretty scary. Well, we could go on and on here, but I want to let our listeners know that you, Cindy, you will be a guest on my other radio program called Boil the Frog Slowly, and that will be a full 50-minute conversation where you and my co-host Sebastian and I will actually dig deeper, and folks can hear that at the website boilthefrogradio.com or at iheart.com. So you and I are going to continue this conversation in depth. So, Cindy, is there anything that we're missing that you'd like to discuss today?
Well, I think that this is certainly a good start.
Mm-hmm.
One last point would be that the combined risk for healthcare workers from toxic chemicals and EMF needs to be known.
Okay.
I mean, for anybody who's just on the edge of thinking that this is, maybe not, or maybe an issue, maybe not, understand that nurses who do work with chemotherapy or other toxic chemical agents and also have high EMF or RFR exposures are at greatly increased risk for damage to DNA and oxidative damage and other things that they don't want to have. So that this is in the can. This is no longer a discussion about possible. It is a fact. There are many reasons for people to want to begin to understand the environments that they're in and then think about taking steps to reduce their exposures.
Right.
And I want to thank you very much for putting some light on a really important topic.
After I saw it firsthand myself, I thought there's no way I can remain silent on this, and I do plan to continue speaking about it. And if you have any research studies or any articles or reports that you think I should be making our listeners aware, let me know. I can highlight them on the show. I'll put them on our website so that we can continue this conversation.
That's great.
All right. So can you tell us where we can learn more about you and what you do?
I don't keep a personal website, but our work at www.bioinitiative.org is the really important central repository for all of the science in public health. And it's written both for the layperson in the beginning, and then all the technical, the hard science stuff is all in the back. It is where we want you to go to understand these issues. And beyond that, if people want to contact me at sage@silcom.com, SAGE at SILCOM, MSNMary.com. I can provide specific references on things that are published if they have a particular interest. So we hope it helps.
And it's just a pleasure to have you with us today. I really, really appreciate your taking the time.
Thanks, Pat.
Well, folks, this is a game-changing topic that no one in the media is really exposing, but when it does hit the fan, and it will, when people start getting sick and connecting the dots, remember, you heard about it here on Speak Up and Stay Alive, Patient Safety Radio. It's time for prudent avoidance. It's time to spread the awareness, and I'm counting on you to help. So stay with me. As usual, there's more to come.